Britain, 33 million vehicles, 250,000 miles of tarmac. Lights and sirens are no longer enough. The biker cops and paramedics are taking to two wheels to beat the most congested roads in Europe. They are a surefire way of getting vital help where it's most needed, fast.
Right, God, big deep breath for me. Okay.
The bike squads of Essex Police and West Midlands Ambulance Service race to protect the public and save lives.
Boy, well done.
Coming up on Emergency Bikers, a child has been hit by a car.
Well done.
Police have their hands full in Essex.
Please let me. You've never let me finish.
No, we didn't drive. And stop.
Let me explain.
Yeah.
And a woman runs amok with a knife.
Just get up!
Birmingham, Britain's second city, home to over 1 million people. Here, biker paramedics can face as many as 20 calls a day. But where there were once 3 bikers, now there are only 2.
I'm going to do it because you don't know how to do it, do you?
I can do it.
You sure?
Barry Rudge is off sick.
Once I've wiped all your Tipex off the screen.
And at Bikers HQ, Steve Harris and Mark Hayes are holding the fort.
We can deal with anything that the city throws at us. It would just be nice if there was 3 of us and we didn't have to be at work so often.
I mean, it's coming up to the busiest time of year. We've got winter pressure. So very shortly we're going to be busier than you know we would be in the summer.
What a couple now.
We are a couple, but not in
that
sense,
you know, physical sense.
No. We're a couple of paramedics that work in
that happen to work together.
Yeah.
So does that still mean we're a couple?
That dress in leather.
For now, Birmingham's favourite paramedic couple will have to brave the city's medical emergencies on their own. On their Yamaha FJR 1300s, with a top speed of 145, they race to any emergencies within an 8-mile radius of the city centre. They carry everything an ambulance carries, and they're trained to deal with anything.
Somebody's thumped you.
To capture the action, we've put special cameras on each rider and bike, so we arrive at the scene the second they do. In the centre of town, an urgent 999 call is coming in.
212 over.
On call, paramedic Steve Harris.
I've just been told a young child has been hit by a car, so off we go.
Nearly 2,000 children are killed or seriously injured being hit by cars every year on the UK's roads. How quickly Steve can get to the child could mean the difference between life and death. And there's no faster way of getting there than a motorbike. The scene of the accident is nearly 2 miles away. It takes Steve just 4 minutes. He's the first on scene.
Boy's hurting.
Right, okay.
A 6-year-old boy was playing in the street and has been knocked off his bike. A bystander has been doing what she can.
Has he been awake all the time?
He's been awake all the time, he's
Crying
been
as he
talking,
is.
he's been crying. He said he hasn't got any stomach pains.
Okay.
He said his neck's not hurting.
Yeah.
He's counted my fingers, he stayed focused.
Excellent.
There you go.
You've done a wonderful job, thank you.
Doctor's going to have a look at you now, okay?
Here we go.
No, he can't because all his arguments. He can't all his arguments. Right,
Your mum, are you? And what's his name? Does he suffer with any problems, any medicines, any tablets?
Asthma.
Asthma? You keep nice and still. Tell me if this hurts where I'm touching. I know it hurts there. You've got to bump your head, don't you? Hey? Oh dear. Okay. Right, I'm going to have a little listen.
In a lot of pain, and Steve's first job is to make him a bit more comfortable.
Do you want to go with some more or more?
Yeah. Put that round, Jack. And is that hurting a lot? Can I give you some medicine? Mum, do you know whether he's allergic to anything? He doesn't take any medicines, tablets?
just inhaler.
Inhaler?
Steve wants to give him Oromorph, an oral version of morphine.
4.2 milligrams, 2.1 mil.
Right, this is medicine. It is. And what we do, we pop that in and you take that in. You swallow it down.
Steve suspects may have broken his leg, so an ambulance has been called to get him to hospital.
That magic medicine's going to make it go away, all right? Here we go.
Open your eyes. You're going to have to, you see the wounds? His skin to his side of his head and his cheek, so you should.
Got a little patch on there.
Yeah, sure. Yep.
Keep still, it's okay. Keep still, keep still.
Here we go.
Keep still.
Steve has to cut off trousers to get a better look at his leg.
Just going to feel a little bit of warmth on there. Okay, that's just covering that up for you.
Yeah, look, you see that? This one, it goes under your chin like that. It doesn't hurt you.
Good boy, well done.
Brave.
Well done, back. Mummy's here.
I'm here.
Anywhere without your mum. Well, we got another crew's arrived, so we got another pair of hands.
You keep nice and still. Don't worry.
Once he's on the stretcher, the team strap in to keep him still. He's obviously hit his head hard on the road, and Steve is concerned about damage to his neck and spine.
Just get some blocks off the truck.
You pop some little straps over your head, okay?
Good boy, well done.
You okay? You okay? No.
Because he's been hit by a car, knocked off his cycle and hit the road, his head has obviously hit the road. We have to look after his C-spine, and that's where the collar came in. Trying to assess any young child can be difficult, but if they're in pain and they're crying, it can be extremely difficult.
He's going to look after you. Yeah. And this one that looks like Father Christmas, he's been looking after you. Yeah.
You coming in, Pet? I've been doing this job a long time now, but even now, any job involving a child can be traumatic. I'm a father, I'm a grandfather now, and I'm well aware that any child I go out to could be one of my own, one of my grandchildren.
It's 8 a.m. in Birmingham city centre. Paramedics Mark Hayes and Steve Harris are waiting for the first call of the day, and they don't get far into their coffees before a call comes in. Mark Hayes is responding. It's an RTC, a road traffic collision, and there may be serious injuries. Mark hits the gas. But just 400 meters into his journey, he's flagged down.
201. Yeah, I've just been flagged down. Somebody fitting in the street. Yes, yes. Yeah, I'm coming now. Watch yourself a second. It's just been seen to fit.
Fellow paramedic Steve Harris was following just behind in a response car, and he stopped too. This man needs urgent medical attention.
Did he go down with a bang?
Yeah, he was just holding his cup and he just fell over.
Okay. I'm just updating and locate. Do you want to grab a blanket and that for us? And I'll have his air while you're... 201. Thank you. I need a vehicle, please. ACAT response. Yeah, Edmund Street, junction of Eden Place. Okay, keep still. We've got blood on his ear. He's got a cut on his ear. Okay. 1, 2, 3.
The man had been walking to work and suddenly collapsed and began convulsing. His tongue has slipped back in his throat, partially blocking his airway. Mark tilts his head back to help him breathe and gives him oxygen.
It's okay. Just relax there.
Hello.
Your eyes. My name is Mark. I'm a paramedic, mate. Open your eyes for me.
Seizures are the result of electrical disruption in the brain. They can take many forms, but commonly involve blackout and collapse, followed by convulsions, as in this case.
You open your eyes for us, mate.
1 in 25 people will experience unprovoked seizures at some point in their life.
It's all right, keep nice and still. Just relax, mate.
Take that on for us.
All right. Just relax. Just relax. The problems we face at the moment is obviously following a fit. They can be a bit confused, a bit disorientated. We have to give him a period of recovery before we start to get anything out of the patient. It's the ambulance service. We're going to pop you on.
Common causes of seizures are epilepsy, brain tumours and strokes.
Sit you up a bit, shall we?
Nice and slowly. All right.
Mark needs to get him to hospital fast.
Got a lack on the ear.
Just about probably straight this bit.
Swing your feet up. I'll bring his belongings on. Hello there. How you doing? What's your name? All right. My name's Mark. I'm a paramedic. All right. Do you suffer with epilepsy at all? No. Okay. What day is it today? You tell me the day? No, don't worry. I'll come back to you. All right. You're on board an ambulance. We're going to give you a full MOT. You're going to need to go to hospital. All right. Okay. How old are you? Okay, not to worry. Take any medications at all? No? Tell me how old you are yet. It'll come back to you shortly. All right. So 4.2 the BM. Sat to 99, I'm showing a rate of 82-ish. 137/84, so that's good. What day is it, mate? What day is it today? Not to worry.
Irregular heartbeat is another possible cause of seizures. Mark wants to run a full set of tests to make sure this man's heart is functioning properly.
We'll do a full 12. What I need you to do is just keep nice and still. Don't move, don't talk, don't shake. Just relax. There you go. Thank you.
The test has detected something worrying.
Small junction, it's right on the QRS, isn't it? Have you ever had an ECG done before? Never? No, okay. We've done an ECG, we've had a look at your heart, and there's some slight abnormalities on that ECG. That needs to be investigated. We've done an ECG on and here, this section of the ECG where my finger is abnormal. And on a 12-lead ECG, it's more obvious because we take a wider view of the heart. So it's definitely something that needs investigating. Right. Because you've had a fit, we don't know why you've had a fit. Yeah. I want to pop a needle into the back of your hand. This is so that if you were to go into another fit, we can give you something to stop that. Is that okay with you? Yeah. Good man, thank you. Following a fit, in the majority of patients, they have a stage that's known as postictal. They could be very sleepy. Some people are even aggressive, agitated with it. Over a period of time, they become more and more alert, and we see a recovery. With this gentleman, we could see over a period of 10-15 minutes, we were slowly getting bits of information out of him. Started off with a name, couldn't remember his age, and then eventually by the time I left him on the back of the ambulance, he was able to tell me his name, his age, where he worked. It was far more compos mentis. Thank you, returning to Cherry.
Essex, 1,400 square miles, home to nearly 1.5 million people. The county is crisscrossed by a network of motorways and dual carriageways, policed by a dedicated biker squad. Today in Southend, PC Steve Clements is on patrol. He's parked up in a petrol station forecourt when a member of the public approaches to report an accident.
Guy reversed into another car and just drive away.
Right.
Just driven off. It was a blue escort van.
Where is he? Just as he got?
2 or 3 minutes he went off.
All Clem's got to go on is the description and registration of the vehicle. But in a busy town centre, the van could be anywhere by now. But just seconds later, Clem spots the suspect van on the other side of the road. He hits the light and pulls it over. But Clem's unprepared for the van's passenger,
The reason I've stopped you, if you just had an accident, you felt to stop to report it.
who has plenty to say for herself.
Well, and he was coming out of his parking space. And as he was coming out of his parking space, this other car came from the side and was eager to get into his parking space. And he's going back and the other one's going forwards.
Right.
And he stopped round the corner.
Excuse me, all right?
Yeah, but that's a fact.
Hang on, let me just get your details first, find out what's going on, and then we'll go back to speak to the other person, all right? You weren't driving, I want to speak to the driver.
Yeah, all right.
You are not an independent witness because you're in the vehicle with him.
Right.
So I need to speak to the driver. So if I can speak to the driver without you interrupting,
Yeah,
we'll
all
be
right, then
appreciated.
do so.
Thank you.
Yes.
The person who just gave me your index and said there was an accident, you reversed into a vehicle and then driven off, okay? So I've not taken the full details from him, I've just come to find you, and I've now got you.
Yeah, okay,
all right?
yeah.
So let me take all your details.
Yes.
We'll complete that side of it, then I'll go back to the petrol station and find out what's going on.
Okay. Has he got a damaged car then? Because this one is not damaged. There's nothing on it.
You'll come and stand over here, let's have a chat.
He went into him.
Sorry?
He said he went into him.
Well, I just said I haven't spoken to the other person. A gentleman's reported the accident and I've come to find out.
Yeah, all right.
A backup car has arrived, which allows Clem to get on the radio to check the driver's details. And there's a problem.
When was the licence expired? No, it's okay. It's revoked in 2002, so it's a year after that, so we're a few years on from that. So can you organise a 165 for me?
But the couple are still arguing about the petrol station. Time for Clem to get it sorted once and for all.
Yeah, what I explained to you was, somebody came up to me and said, they've had an accident over there, he's reversing the vehicle and just driven off, right? And I said, hang on, please let me, you've never let me finish.
But we didn't drive off to stop.
Let me explain.
Yeah. All right.
Right, he's reported to me, he's given me the index of the vehicle. That vehicle's not there, the other one is, so I've gone off to find the other vehicle, right, and I've found you. If nothing is exactly as you said, then nothing will happen. However, since then I've done a check on your vehicle and on yourself and found that you haven't, your licence is expired. As we're dealing with something different now is the fact that you haven't got a licence. Okay, and that's what we're dealing with
And
now.
it's news to him and to me.
That you've never had a licence in your new address because it's in your old address of 8 years ago.
Well, he did apply for one, but things have happened in the meantime, and a lot of mail has gone astray.
But in 8 years you would have thought, well, why am I not got a licence in my present address?
Yeah, I suppose it does occur to you. And
But today, the vehicle's being seized off you because you haven't got a licence to drive.
As neither of them hold a valid licence, Clem will be seizing the van, and the couple will be left to walk home.
The thing is, though, I mean, as far as I was aware, my licence still runs up to...
Yes, I appreciate what I said. You're still qualified to drive, but you've got to hold a licence to drive.
Yeah, but I thought I had a licence.
Yes, but you haven't.
we have to go to DVLA.
I've explained that all to your husband, what he needs to do.
Okay.
He's got all the
But
paperwork.
he'll still be able to drive, won't he?
Once he's still qualified to drive,
Yes.
but he's just not authorised to drive because he hasn't got a licence.
Oh, I see.
So he's still a fully qualified driver.
Yes.
He just needs to go and get the paperwork to make him fully qualified
Oh, right
driver.
then, okay.
Yeah, and once
All
he's
right then.
been to DVLA, sorted it out, then he'll be allowed to drive again.
All right then. Okay.
All right then.
All right then.
Okay.
Thank you.
All right,
Thanks
bye.
very much.
See ya.
Thank you. All right, thank you.
Driving without a licence can carry a penalty of up to 6 points and a fine of up to £1,000. And it means you're not insured. Uninsured drivers cost law-abiding drivers £500 million a year.
They haven't got a licence. You've got to be right selfish in this, that if they had an accident hit your vehicle, they wouldn't be insured. So you've got to be selfish in the fact that if they hit my car, I'm paying out for it. So with these seizures that we do for no insurance and driving licence, it's a quite important thing that I pay for. I've got quite I've got a few vehicles and motorbikes in my whole family that we've all got, and we pay insurance and we've got a licence, and I'd like to think that other people have. So, but they seem quite good about it. I've explained how to get his licence back to make sure that he's back on the road, and he seemed quite happy with it.
After more inquiries, the shunt needed no further action, but Clem is still satisfied with his day's work.
It actually was a very minor accident in a car park that the other party wasn't even bothered about because he went into the shop and left them to get on with it. But it's gone on to it, and unfortunately for this gentleman, he hasn't got a driving licence, and so we've seized his vehicle today.
Birmingham, a 999 call is coming in. Paramedic Steve Harris is responding. The call is to Birmingham New Street, the biggest railway station in the city. A woman has injured her back on a train. An ambulance would have to park at the entrance, but the biker paramedics can ride right into the heart of the station, saving valuable minutes.
Hiya. What's the problem?
My back's in a lot of pain and I can't really move.
Okay.
It's my lower back.
Lower as in... just across there. Okay.
Just in so much pain.
You ever had that pain before? No? And how long have you had it now?
I hurt it.
It's 4:45 now.
I hurt it when I was at Euston Station, so about just after 2 o'clock. I'm in so much pain.
Okay. Is this the end of your journey? Is this where you were coming? Yeah? Right.
But this woman's back pain is not her only problem.
Birmingham City.
Apart from your back, are you normally fit and well?
I'm type 1 diabetic.
Okay.
But that's about...
Have you eaten today? You do sugars?
I have sugars, yeah.
Yeah. Okay.
I'm travelling and it's just difficult.
Okay, all right.
Type 1 diabetes affects around 300,000 people in the UK, typically children and young adults.
Yeah, but I mean,
Insulin injections keep blood sugar levels under control. If these are too high or too low, diabetics can slip into a coma.
Today, no.
what's your name, by the way?
Laura.
Laura, with an L. When was the last time you ate?
Well, an hour ago.
Okay. So your sugars should be fine. Do you have any problems with it?
Not the best control.
It isn't. Right.
A normal blood sugar level should give a reading of around 4.
What would you think your normal is?
It feels like it could be 19 or 20.
19. Would that be normal for you? Yeah? Okay.
28.
It's not very well controlled, is it?
Not today.
No. Presumably that isn't that much of a surprise to you, 28. Yeah. Okay. And on a pain score of 1 to 10, 10 is the worst pain you've ever had. Where would you put this at the moment?
9.
It's as bad as that, even while you just sat there. Yeah? Okay. I can give you morphine now, and that'll hopefully help to ease the pain. The other way we can do it is when the ambulance gets here, we can try you on some gas and air and do that way. You'd sooner have gas and air. Okay. We'll wait for the ambulance and we'll see what happens.
Yeah.
Okay.
Because I'm needle phobic as well.
You can't be needle phobic, you're a diabetic. How does a diabetic become needle phobic? Okay. Hiya. All right. This is Laura. She's insulin dependent diabetic, which at the moment, 28.2. Oh, you're not going to giggle on me, are you? Yeah?
Just told her it's also known as laughing gas. Do you want the back sat up? Hold your arm, get that. Yeah.
1, 2.
After a few minutes on the gas and air, Laura is able to move enough to get onto the stretcher. And after a few more minutes, life is looking a little brighter.
Can you get this on prescription?
But the situation is no laughing matter. Complications from uncontrolled diabetes are very serious. Blindness or ulcers so severe that limbs have to be amputated. In extreme cases, high or low blood sugars can be fatal. Laura needs to get to hospital fast. Essex. With 2 major motorways and 4,000 miles of roads, cops here are locked in a constant battle to control the traffic passing through the county. 7 a.m, Essex Biker HQ. Sergeant Dan Parsons is briefing the team for a major operation.
Right, good morning. It will be brief, don't worry.
Officers have been drafted in from across the county for Operation Calypso, cracking down on travelling criminals.
There'll be 4 separate sites supported by patrol vehicles to bring vehicles in. We're looking at vehicles carrying scrap, vehicles carrying or towing plant, and any large goods vehicles.
There are a total of 7 bike cops spearheading the operation. On the front line, PC Roy Keys. Each cop has a role to play. The bikers will be scouring the roads to intercept suspicious vehicles, then escorting them into the secure compound. Marked rapid response cars will be circling the catchment zone, picking up any drivers which might try to sidestep the bikes. The checkpoint team are in place. Roy and the bikers hit the road. Cars equipped with ANPR, automatic number plate recognition, are parked up at strategic points along the main arteries in the area, feeding intelligence back to the bikers. Within minutes, the biker net is hauling suspicious vehicles into the checkpoint.
OK, have you got any ID on you? Were you aware that there was no MOT on it?
I thought it was the end of this month.
You thought it was the end of the month? Oh, a little bit out there. What about your tax? Are you aware that that's out? Sorry? Yeah. You were aware? OK.
On the road, Roy has his first catch of the day.
The black Vectra, it's got a theft of petrol report on it.
The checkpoint cops can deal with this one. Roy heads back out onto the road. Another patrol has spotted a transit van trying to dodge the net, but biker cop PC John Harmon is no fool.
I was up the road, turned into a side road. Moments later, a friend who was sitting up in a plane car notified me on the radio that a full transit van had just turned into the road, and for some reason, they can only think upon seeing me, the van suddenly stopped, did a U-turn and accelerated away back in the direction it come from. I went after that van and we then brought it back into the site here.
You've been seen acting suspiciously. You've got highway maintenance signs on there, which I'm not too happy about, okay? And you've also got bolt croppers as well, okay? I'm now going to search you both and the vehicle fully, okay? And the reason I'm doing it is because we believe you may be involved in crime. If you've got anything that's going to hurt me, first of all, that's more...
If these suspects have anything to hide, the checkpoint team will find it.
Right, those bolt croppers, where they come from?
Out the yard, it's scrapyard. Just picked them out of the scrapyard.
You picked them up in the scrapyard?
Yeah, the scrapyard.
How much to pay for them?
It was in the evening, the rubbish, it doesn't matter.
Well, you stole it from the scrapyard then, didn't you? I'll tell you what we're going to do, we're going to ring them and ask them if you've got permission to take stuff from their scrapyard, because once it's in their scrapyard, that's their property.
Yeah, but I just chucked some in there.
No, there's no yeah but. There's no yeah but about it. If you've taken it off their property, if you haven't got permission to take it, it's theft.
If I give you a registration number, can you see if it's been in recently? It says it has. Yeah, has he been in recently? He's got a set of bolt croppers on the back of his van and he said he's picked it up from your gaff.
The scrapyard confirms the cop's suspicion. This man's in trouble.
I'm arresting you on suspicion of theft of some bolt croppers from the CTAR scrap metal plate, okay? You do not have to say anything that may harm you.
If found guilty of stealing the bolt croppers, this man could face a jail sentence.
Maybe given in evidence,
okay? Well, for me, you want to do for mine.
Okay, yeah, you've already told my colleague that it was you that took it, so that's why we're just arresting you. We're not going to arrest your boys, okay? We're not going to need to handcuff you, am I? No. Take your driving licence back. Pop yourself in there, put your seatbelt on.
Back on the A12, another white van has triggered an ANPR camera. Intel reports numerous speeding tickets and connections with outstanding police inquiries.
Stop.
Roy is perfectly placed to intercept.
You can follow me in the services. We're doing commercial vehicle checks there. Hello, fella. All right. Thanks for that. Is it a company vehicle or your?
That is company.
Company vehicle. Have you got your driving licence on you at all? There's a few checks. Lovely. Do you want to just jump out 2 seconds? The reason we stopped you, I think, is a report against the index.
They got rings a few months back, if I remember rightly.
Is it? So you know something about it?
Yes.
Ringed is another word for cloned. The number plates of this van have been duplicated and put on a matching van, which has then reportedly been used to commit crimes. And this driver has a letter from the DVLA explaining the situation.
Lovely. Could you just check the last bit, the chassis number you got on that vehicle, please? Oh, OK. Obviously there's, or has been, another vehicle driving around that you're aware of, so it's worth carrying that letter with you, though, just so that when you stop, you get aware.
OK.
Just drive carefully and out there. Thank you. Cheers.
It's been a successful day for the Essex bike cops. 188 vehicles were stopped, 2 people arrested, and 30 fixed penalty tickets issued. In Birmingham, it's a busy Monday lunchtime in the city centre. But on the edge of town, a serious situation is developing.
Yeah, we're just booking in attendance now.
A woman has been seen brandishing a knife on a residential street. Police are on scene, and there are injuries. Paramedic Mark Hayes is on duty.
What's the story?
As I've got it,
yeah.
She's been in the middle of the road waving something, and I've played around.
Oh, right, OK.
I've had a good look at the blade. I've backed off a little bit, got the dog out, and she has then come towards these 2 officers to attack them with the blade. I've sent the dog at that point, having sprayed her as well, so she's been CS'd, and she's got injuries on her arms and legs as well.
You guys move away.
Yeah.
She's aggravating her more.
The woman doesn't like having men anywhere near her.
I'm a paramedic.
Mark will have to tread carefully to get close enough to treat her.
My name's Mark. You can let me have a little look at you. We'll sort you out, yeah?
That's all right.
Let me grab my first aid kit. Where's the pain the worst?
Let me get you onto that. You ready? So, there we go. All right, let me pull this down.
Whew. CS.
The woman has been sprayed with CS gas to subdue her.
Oh, I can smell the CS.
Yeah.
How are you coping?
I'm okay.
Ah, all right, my love. Nice and still.
Pretty good.
How much alcohol have you had today? Not enough. All right. Are you going to transport her a wee?
Have you got an ambo here?
Not one at the moment. I can get one.
I don't want to go with nobody else after you. Okay, yeah, but was you saying about getting you onto an ambulance?
You've still got to go to hospital, haven't you?
Yeah, I'd rather go with Sarge. Okay, what do you know where your handcuffs? I'm just going to bring you to your front.
Do you want us to get a blanket so we can make you decent? All right, OK. Pop this round.
The lady's wounds are simple to treat, but Mark needs to assess her overall health to make sure there is nothing else which might need urgent attention.
Other than alcohol, have you had anything else? Any drugs or anything? Diazepam, OK. Do you suffer with anything normally? Do you take any medication at all?
Have an inhaler, yeah? Pancreatitis.
Pancreatitis. You're an alcoholic, are you? Yeah. How much alcohol have you had this morning?
Whiskey, I don't anything else. I had enough. But we just need to look after it. I had enough.
Can I just get to your arm, my love? OK, just the one arm, so we keep you decent. The wound on your arm is quite superficial, so it's not too bad, yeah? And then they'll sort you. It's quite, they are fairly minor. I know they're painful and it's obviously shocking for yourself, but they are relatively minor.
I'm not bothered. I don't care no more. Miss, I don't care. Well, we need to try and sort something out. Okay. I've never done anything like this in my life. But we need to get that sorted in that way.
Okay. What we're going to do is we're going to pop you up to Dudley Road Hospital. All right.
Let's get this round.
We take a slow walk to the truck. We'll come back to the kids in a minute.
Yeah, I'm going to come with you.
Yeah. Nice and slowly. Watch your step as you go. We'll have a chat on the back of the Amber. She's been CS. You might want the windows open a bit because it's burning my throat. She's had alcohol, 2 diazepam. She's an asthmatic alcoholic with no known... yeah, with no known allergies.
Can I wash my face or something?
Water will make it worse. You just need fresh air. Windows open, we'll get you off to hospital. CS gas, not pleasant. I've been out to many a job where CS gas has been used, and how people can still carry on is beyond me. The sensation of the burning throat, burning nose, runny nose, your eyes start to sting and start to water. Bearing in mind, we turn up some minutes after the CS gas is used, and it's still there. This lady, we got her onto the back of the ambulance, and the smell is phenomenal. You've got to open the windows, put the blowers on. It really is potent stuff.
But there's one thing Mark hates more than CS gas.
I don't mind saying that certainly police dogs, you see them in action, and it reminds you adrenaline's brown.
(8:15 a.m., Birmingham. A 999 call has come in. An elderly man is suffering extreme breathing difficulties. Paramedic Mark Hayes is responding.
Hello. Where are we going? Upstairs.
When Mark arrives, he finds 72-year-old Jimmy barely able to breathe.
How are we doing? Terrible. You sound it. Okay.
Mark puts an oxygen monitor onto Jimmy's finger. A normal reading is 98 or 99%. Jimmy's is down to 66%.
Okay.
Mark needs to act quickly.
All right. Okay, we'll have a little listen to your chest. We'll get you on something, all right?
Jimmy suffers from COPD, or chronic obstructive pulmonary disorder.
I'm on nebulizers.
Yeah. It's going to be a bit cold, all right?
All right, I don't mind the cold.
All right.
Good from the north.
Keep going.
It's estimated that there are over 3 million people suffering from COPD in the UK, 3 times the population of Birmingham. It kills almost 600 a week. The most common cause, smoking.
Okay, we're going to give you another neb. All right. You got any pains or anything at all?
I've got any pains now.
All right.
Just kind of bleeding.
Give me something now, but I'm going to give you some ipratropium and salbutamol. So how long's your breathing been this severe?
For over the week.
Over a week.
For a week.
Okay. Okay, get this neb on you. Protect your nasal.
Take that out here.
Okay, some nice deep breaths. Get that.
How you doing? You all right?
Down into your lungs.
Jimmy, what we need to do, mate, is do some more checks on you.
Mark wants to get Jimmy onto a heart monitor. And if he's stable enough, the team will move him to the ambulance and off to hospital.
We're going to attack you from all angles, Jimmy, all right?
Want to just sit up?
No, you just relax, mate, the best you can.
Not much left of it.
Hey?
There's not much left of it.
Oh. Try to keep that hand nice and straight and relaxed. Hand out straight. Go on, you can. Is that nebulizer helping you at all?
Yeah, not really.
Not really. So, we can see a difference in your oxygen saturation. So it is doing some good. You may not feel it at the moment. All right.
Yeah.
But that's a massive improvement to what it was.
Jimmy might not feel the nebulizer is doing any good, but the level of oxygen in his blood has risen nearly 40%.
So how long have you had breathing problems for, Jimmy?
4 years.
Years.
He's also an ex-smoker, heavy smoker.
I was a smoker.
Yeah.
I'm a boozer.
And a boozer.
How long ago is it since you're back in smoking?
4 years, easy.
4 years.
Easy.
Yeah.
I'm drinking. I can't get out.
No, that's bad, isn't it?
I've only got that much in me here. There's oxygen here.
Yeah, you just relax. Just take that in. Don't worry about talking for a bit.
The other one.
Just, Jimmy, just relax, mate. Take on him.
Jimmy's condition has been made worse by a chest infection. He needs to be taken into hospital for further observation so the doctors can tackle the infection and keep him breathing.
Yeah.
All right, Jim.
I've got a 72-year-old gentleman. Yeah, COPD patient. He's severe respiratory distress, and we've got an ETA of about 5 minutes. All right, cheers.
He's been struggling for some time. The body becomes tired, and there's only so long you're going to keep struggling, and then he needs to receive treatment as soon as possible. So we're going in on blue lights. There'll be a team waiting to receive once we get to hospital.
Jim, this may be all a bit alarming, all right, but this is just because obviously you're struggling to breathe there. Although we've seen an improvement in you, we need to get you to hospital so we can get you to improve. He's far better now than when we first got to him. Hospital will now do further tests, they'll have x-rays, blood gases, and possibly change his antibiotics and his medication regime and try and get on top of the infection. But yeah, decent bloke, he's going to get sorted, so should be a good outcome. Breathe there.
Jimmy spent 4 days in hospital, but has now recovered from his chest infection and is back home with his wife, Shirley. Had broken his leg, but there were no other ongoing problems from his bike accident.
My name is Mark.
Suffered cuts and bruises and a perforated eardrum when he fell in the street. Despite running lots of tests, doctors still have no explanation for his seizure. Laura was in hospital for 2 weeks and diagnosed with ketoacidosis, a condition which can send blood sugar levels soaring and needs good insulin control. And the handcuffed lady treated by Mark suffered no long-term injuries and was later found guilty of criminal damage, affray and possession of an offensive weapon.
Okay, nice and still.